Welcome to today's PAWSCAST.
Hi, everybody. My name is Dr. Amanda Vandeveer, and I'm here with Becky Meyers, the Outpatient Addictions Program Director and Prevention and Promotion Program Director at Allegany County Health Department, to talk to you today about Narcan. So overdose deaths are a problem in our area and across the country, really. Why were there so many deaths? What's going on?
So if you're going to take us back a little bit, around 2019, we actually started seeing a decrease. And so a lot of efforts have been put in place probably the past 6 to 8 years prior to that.
And that was pre-COVID.
COVID happened, so we were looking at the data in 19, beginning of 20, still seeing those trends, and then COVID happened.
Yeah.
So as you know, that created a lot of isolation, depression, job losses, and it also put things out like stimulus checks. So for people that are struggling, that were using drugs, obviously giving somebody some unanticipated money also creates a lot of desperation and also confusion.
Yeah.
So when the COVID numbers started to increase, we started seeing the deaths of overdoses also increase. And so that continued in 2020, 2021, 2022. And sadly to say, here in 2023, our numbers still in Allegany County are not looking very well. As of mid-May, we were looking at approximately 21 deaths in our county. And I do know there are other deaths that I just don't have the data for. So that's somewhat disheartening, given that in 19 we were making strides.
Yeah. So the switch from pre-COVID to post-COVID, it's definitely been impactful on people struggling with addictions.
Absolutely. And another thing I didn't mention was that they were abruptly changed from in-person treatment that they were used to, oh, well, by the way, we're going to be doing this, via telehealth. We've never done this before, or maybe I've never met you before and we're not established.
Yeah.
So, across the nation, that's what was going on to continue to keep services going. So again, that's that isolation. I'm not connected. I'm not going to 12-step meetings. I'm, now getting online, doing Zoom meetings. And again, I may be connecting with somebody, it's across the world, versus somebody locally here in Allegany County.
Yeah. And it's hard to connect when you don't live in the same culture. We're all in the United States, but, East Coast Appalachian culture is different than even like DC culture.
Absolutely. We're very different here. It's being in a rural area and, trying to acclimate yourself to getting online that you were not used to doing. Maybe you were just walking a couple streets over and hitting a meeting in a local church or something like that. Now, you might be using electronics that you're not used to, doing that tech stuff that a lot of us struggle with.
Yeah, absolutely. So can you tell us about the Narcan availability and how easily accessible it is here in this area?
Sure. So in 2014, we'll back up. And Narcan has been around for over 50 years. Wow. So it's been used in the medical field since about 1971. So it's not new as like there's this new drug. So what's new is the bystander law, which is actually 9 years old. So in 2014, that was announced in Maryland that a bystander would be able to administer naloxone if somebody was experiencing an opioid overdose. So the Allegany County Health Department became an overdose response program. That was like an authorization that we could do training with individuals and then provide them with either a prescription back then for naloxone, or now it's different that we go ahead and do the distribution and dispensing of the naloxone. And kind of fast forward, we now have AHEC West and also Maryland Wellness, ourselves, Chrome Probation, are all overdose response programs, or ORP as we sometimes call them.
Okay.
So that's one avenue. And most recently, we have been able to do 3 naloxone vending machines in the county. We started with one at the Possibility Shop in the downtown Cumberland Mall back at the end of March, the Georges Creek Library in Allegany, and just recently here across from the university at the Frostburg Armory, and that's an outside machine. So over the course of the past 2 months, we've launched those machines, and as of date, there's been about 146 dispenses So that gives an individual an opportunity. It's free. The individual can go up to the machine. You're basically putting in date of birth, gender, zip code, and it's dispensed out.
So just demographics, you don't even have to put in your name?
Absolutely, absolutely. And so what you would get from the machine, you would actually get a box of naloxone just like this, and also have some other instructions with it. But what's really great about the box of naloxone is that all the steps are included on it.
Nice.
And it gives, you don't have to carry around all kinds of instructions or anything. It's all with the box. And then we provide a wallet card with signs and symptoms of an overdose. We provide treatment resources. It's really hard to get everything in that coil as it's coming out to vend. So everything has to be boxed around the box in order for it to vend. So we're really excited about this new endeavor, and we're excited too that the community is also embracing this new idea.
That's so wonderful, because having that available, it's going to save lives.
Absolutely.
Yeah.
Absolutely. It gives somebody, so we've been doing, I want to just take us back a few years. When COVID happened, we were still doing in-person community trainings. The health department's been doing trainings since 2014, and we went to virtual. We thought, how can we, continue with our program and also adapt to what was going on?
Yeah.
So we did virtual online trainings, and then we mailed the naloxone out to individuals. Since 2020, we've been doing that. We also offer in person, but a lot of people take us up on our virtual trainings. We also do trainings within organizations, businesses, doctor's offices. I mean, if you just call us, we can set up the training. It's all free, and we make it happen. So we're excited about that. We also get the naloxone as well. So whatever the request is, we go ahead and make that.
Yeah, so you can even set up trainings like on campus.
Absolutely.
Yeah.
For sororities, fraternities, athletic groups, community groups, anything. It's free of charge, and we'll be really excited to do it.
Nice. Y'all call her. Okay, so what happens when someone is given Narcan? How does that work?
So naloxone only restores breathing if an opioid was used.
Okay.
And so what's really important about that is you don't need to be able to figure out did they actually take an opioid or not. So you go ahead and give it if you see things like slow or shallow breathing, unconsciousness, blue fingertips, toes, pulse, no pulse, or your body might be feeling clammy. If somebody did not take an opioid, you're not going to hurt somebody.
Okay.
So again, as I said earlier, naloxone is not new. It's been around since 1971, and medical professionals have been using it in the hospital setting for all those years. So that's a really good thing. The other thing about naloxone that's very helpful is it's kind of like one size fits all. It's the same dose for everybody. So whether you are 6 years old and being administered naloxone, or you're 66 years old, or if you weigh 50 pounds or you weigh 400 pounds, it's the same amount. And that makes it a lot more simpler that you don't have to figure out dosage or weight or anything like that.
Yeah, because if, say, your 3-year-old younger brother gets into grandma's opioid pills somehow, you can just give it right to them without being concerned about any of that issues. Well, that's great.
And the most important about that is we want someone to always be calling 911.
Yes.
So with the vending machines, I want to take a step backwards as well, is to say that, get your naloxone now. Don't wait for an event, because you don't have time to get in a vehicle. You don't have time to check, that's a machine. So you're dealing with a machine. You don't know if that's going to vend or not.
Right.
That could happen.
Yeah.
So you want to be proactive, get your naloxone, and have that readily available. And, what's important is that you had mentioned a situation where a toddler might get into someone's purse. Yeah. A couple other situations come to mind that are not just the obvious of somebody that's using drugs. So let's talk about, grandma that decides to go to her grandson's basketball game and had just had a recent hip replacement. She decides to climb up those bleachers and knowing I may need to take an extra pain medication in order to kind of get through that opportunity. Grandma actually takes too much. That's an overdose situation.
Yeah.
You're not planning on that. You're not planning on a toddler getting into someone's purse. Another opportunity too is that we don't know who's coming into our homes. If you have a teenage son or daughter, or even an adult son or daughter, and they bring someone home for the first time over a holiday, and you don't know, maybe that person may have not shared that they're in recovery and they have a relapse at your home in the bathroom. You know, you have to call 911 to be able to assist in those situations, because if you don't have naloxone, the only thing you have is rescue breathing.
Right, and that doesn't always work as well, especially with naloxone. That will negate the issues, right? That'll help people to breathe on their own.
If it's enough naloxone, because you know, what has shifted and changed for us is that a lot of our overdoses are fentanyl related. You know, that has been a huge shift in the last couple of years. So you really don't know what the individual has taken. And a lot of times it's multiple drugs that could be cocaine, methamphetamines, benzodiazepines, and then fentanyl on board. That naloxone, if it's enough naloxone to take that opioid off that receptor site, you're still stuck with all those drugs being there.
Yeah.
And so if it's not an opioid overdose, maybe it's a diabetic coma, maybe it's a cardiac arrest. That's the importance of having 911 called, to be able to have that backup and assistance. And also, as I showed you earlier, this comes with 2 doses of naloxone, and let's say you've used your 2 doses. Again, the only thing you have left is rescue breathing while you're waiting for medical personnel to arrive.
And it's okay to give the second dose?
Absolutely. And you know what we find out from reports from law enforcement and other people in community, that a lot of times it's taking more than 2 doses.
Wow.
Right. Yeah. Sometimes it's taking 2, 3, 4, 5, because of the you know, the strength of that fentanyl, which again is not pharmaceutical. It's, you know, there's no ingredients, you have no idea, and what else may be placed in those drugs.
Yeah, and fentanyl is a huge problem. It's so toxic.
Absolutely.
Yeah. So we don't have to worry if it's not an opioid overdose and we give it. Everything's fine. We don't have to worry about the weight or anything about the biological stuff about the person. It's not going to harm them in any way. So that's really good. And a lot of people think that they don't necessarily, I've heard people say this, I don't know anyone in my circle that's addicted to opioids. So I think your examples of like a grandma, I know people that would do that.
Sure, absolutely.
I need an extra pill. Yeah, so it's very possible. And I think a lot of people, because there is still a stigma attached to addiction, aren't going to share that openly with someone they just met, like somebody coming into your house to visit. So very good points. So how do we get it if we have to get it? You said over by the armory. Okay.
And it's outdoors, and so it vents 24/7.
Yeah, and
so it's available.
And that's behind Westminster Hall from us. Now, do we need to be trained to use it?
So what I pointed out earlier was that the box has all the steps on it. And again, our numbers on the actual vending machine, our numbers are enclosed in the packet. So if anybody has any questions, we'd be more than glad to either jump on a Google Meets, they can come to the health department, whatever they feel comfortable. If they don't feel like they can follow the easy steps on the box, that, as like I said, it's been a great thing to be able to have that included, and we can actually see it.
Yeah, and that's definitely not something to do in the moment when you need it. That's something to plan ahead.
Absolutely.
Read over it, check it.
Know what the 5 steps are, right? And then 2, that you want to be calling 911 so that they can help and guide you as well. So that's that extra set of support of the importance of calling 911.
Absolutely. Yeah. So how can we understand the importance of Narcan? So how can we spread that word? Like if someone out there wants to spread the word, like, hey, Narcan's really important to have on you, what's a good way to do that?
Right. So we have a Facebook page called Prescribe Change Allegany. We've had that movement since 2015. And that's a great way to like and share. Get that information out. We have posts on pretty much on our regular monthly basis. We talk about fentanyl. We talk about stigma. We talk about naloxone. Our monthly training is advertised on there as well, of all the information more to be able to Everything's very simple. You're just basically doing a Google form for your application. And like I said, we can mail that naloxone. Our Prescribe Change Allegany website has lots of great information, more information about naloxone, has information about the naloxone vending machines, the times that they're available, because obviously the Possibility Shop and the library system are both indoors and do have opening and closing times.
Yeah.
So again, it's that being proactive. We're not looking for someone again to get in the car and think there's an overdose, so you're going to go be able to get access to one of the machines.
Yeah, because you only have minutes. It's not like you have the next 2 hours to get there eventually.
Exactly.
Yeah.
Exactly.
Yeah. So what happens if someone wants to go into treatment, that maybe they've had an overdose where they had to be Narcaned and they're like, oh my gosh, I have a problem, I need to go into treatment.
Sure.
What can they do?
So speaking that, I work actually for the health department, that we have walk-in hours, Monday through Friday, 8:30 to 3 o'clock, and an individual can walk in, present themselves, and we will go ahead and assess what level of care is needed for them. Those resources, again, are on the box. Time of the walk-in time is what we have available.
That's great.
Right. If for some reason we're not able to assist them, we will make the referral for them. So that's available to them. Obviously, I always suggest overdoses or bad situations don't always happen between the hours of 8:30 and 3 o'clock, to utilize other aspects of the system would be AHEP West has a 24/7 peer hotline that we are working on having decals put on the vending machines for that number as well. And that information is also located throughout all of our information. Utilizing the hospital, calling the crisis line. Maybe you need to go to the hospital to get assessed medically, what's going on. I mean, what's really important after somebody's experienced an overdose is that they do go to the hospital. They may seem like that they're fine to their family or loved ones, and they may try to convince themselves. However, naloxone only stays on board roughly anywhere 30 to 90 minutes, and somebody can actually re-overdose. And so you've already used those 2 doses of naloxone, or the ambulance has already left. So you end up overdosing again. You may not have what you need in order to save someone's life.
And it doesn't even matter if you don't take any more opioids after the Narcan.
Correct.
Your body just still has that.
Right. Absolutely. Right. You're just pulling that opioid off that receptor site, and you don't know whether or not, because you don't know how much you take it. Again, we're talking about, illicit fentanyl.
Yeah, because there's no dosage.
That's right.
That's
right. Absolutely.
Yeah. So what type of resources about Narcan are available on campus here?
Okay. So we work closely with Dawn in the SAFE office on different aspects of what we have in the community, and we try to partner anything. Again, here's a partnership that is really great, that we're able to bring this information to the students so that they're aware of what's available. I do want to go back and talk about a point of, we should be getting naloxone. I want to mention again, because I know a lot of students might be seeing this podcast, and some students live here locally and some students don't live here locally, and some of us don't know what situations that individuals live outside of here. So it might be important, maybe they have a 14-year-old brother that might be struggling with addiction. They may have a parent, so that they can, just basically walk over to the vending machine and have naloxone if they're going home for Thanksgiving break or they're going home for the summer, and no questions asked. So I really want to point out that there are many different situations that many of us are not aware of to be able to provide them access, or they feel like, I'm a student, I don't want nothing to happen to, my availability to be here, to have a scholarship or something like that. You don't know what goes through a person's mind of, like we talked earlier about, stigmatizing. And we want to make sure that anybody that would like naloxone has the availability to get it.
Absolutely, that's super important. So on campus, so do we have like drug take-backs and stuff like that?
So there are drug take-backs throughout the county. We partner with law enforcement agencies, and we also have green boxes. So there's basically 2 different kinds of take-backs. One is the permanent green boxes that you all have in the police department, the university police department, that anybody can actually go in and place medication. It does not matter what medication it is. We ask that no sharps or liquids be put into but no one's going to look at and see that prescription and say, oh, Becky Meyers, you're taking X prescription.
Yeah.
No, it gets put in there and then it gets destroyed. And so we've had those boxes in community now since 2012. So we have 5 law enforcement agencies, and we have a magnet that we try to get out into community around, the times and locations of, we have the sheriff's office, we have Maryland City Police, Maryland State Police, Frostburg City Police, and as I mentioned, Frostburg State University Police. So that's a great way too of getting things out of your house that either expired or not needed, so that misuse or a accidental overdose does not occur.
Okay, and this is for just prescription drugs?
Any type of medication, except liquids and no sharps.
Okay.
Absolutely. And then there's another opportunity. Let's say you just don't feel like, dropping off at a green box, and let's say maybe you don't feel like going to a medication take-back event like you mentioned before. So sometimes we partner with pharmacies, sometimes we partner with different events that happen in the community that law enforcement can take those medications back at those events. So they're the only ones that are allowed to take back those medications. There's a deterra bag. It's a deactivation bag, and I actually brought one today. That you can, this is a small one, and you can basically just pour off the top and put the pills in, and it'll tell you how much you can take, whether it's 15 pills or the amount of liquid or the amount of patches. And then you fill to the water line and you shake it, and it deactivates those medications. And then you can go ahead and safely dispose of that in the trash. So there's not going to be any opportunity for misuse or abuse that way. Again, that's at home. You can contact us at 301-759-5050, and we can get you a deactivation pouch. Again, if you've had a surgery and you've only been given maybe 15 pills and you only needed to take 8 and you want to get those out of the house, that's a great resource to be able to make that happen.
Another issue that I just thought of, my dad's famous for this. I just threw away pills from 2013 surgery that he had. And Dad, you can't use these ever.
Yeah.
They've expired.
Yeah, and I think what's important is we know that if you need medication, your provider is going to prescribe it to you.
Yes.
So you don't need to save it from one episode to potentially another episode. They're going to prescribe it. So you want to get that out, especially if it's not locked up. We talk a lot about safe storage at the health department and getting messages out there about locking your medications up. And it doesn't matter if they're opiates or not, you need to lock them up.
Yeah, absolutely.
One medication you don't want to lock up is naloxone. You want to have that readily available.
Because that's safe for everybody.
Absolutely.
So that's really good. Are there any other types of resources that you would like to talk about on campus or in the community?
Yes. So recently, in the past probably year and a half, there was a national number, 988. You can text it, chat, actually talk to a clinician, and it's available 24/7. And it's a great opportunity for us here in Allegany County, Maryland, and the United States to have that available. It's for either suicidal type of issues, mental health crisis, and substance abuse issues. And also, family members of loved ones can also call as well. So sometimes, having that extra support is readily available 24/7. So again, texting or chatting 988.
Yeah, that applies to a lot of people.
Absolutely.
That's great. Any other resources?
I want to mention that we talked a little bit about the naloxone vending machines, but recently we just got a card that has all the locations. This information is also located on our website. So again, gives people the opportunity to know when those sites are available to go ahead and vend, that medication, to be able to have that available. And also gives you the steps on here as well.
Okay, that's great.
For dealing with an overdose.
That's wonderful. That is all good information for everybody to have and know. So who do we contact and get you or someone in your office to come and do a training for a group of people?
Sure. So if you just call 301-759-5050, you can ask for myself or any member of our prevention staff, and we can get that set up.
Okay.
And again, that can be either in person or virtual. So either way, whatever works best for the organization or business.
Nice. So get calling, people. And is there anything else you would like to add to that?
Now, I just really wanted to thank you all for the opportunity to bring this information to the student body and also to citizens of Allegany County.
Yeah, absolutely. And thank you so much for coming today. We really appreciate you coming to spend the time and talk about this. This is definitely something that's near and dear to my heart. I know people who have passed away sadly from overdoses. So it's very important for people to understand that affects everybody at some point, unfortunately. So please continue with the good work, and thank you all for watching. Bye, everybody.
Thank you.
Thank you for being a part of our PAWSCAST. This health and wellness podcast is brought to you by the Prevention Center and Peer Education Network at Frostburg State University. If you would like more information about our programs, visit us in Pullen Hall, room 109, or call us at 301-687-4761. Or you can always send us an email at safeoffice@frostburg.edu. Remember to watch our other episodes and stay tuned throughout the semester. Thank you!